Thank you very much for the kind introduction, and thank you very much for the invite. I'm very excited to be here. I think I'm probably just presenting a small piece of truth today, so it needs some of your creative thinking as well. And just to say, before I start, some of the slides that you are having in your handout might look slightly different from the ones I'm presenting today. But the same presentation, and also apologies to those who already had to listen to the presentation yesterday. So my name is Annette Bauer. I'm a research officer at the PSSIU. The PSSIU stands for Personal Social Services Research Unit, and our mission is to conduct high-quality research on social and healthcare to inform and influence policy, practice, and theory. Our LSE branch was established in 1996, and we have and the PSSIU itself was established in 1974 at the University of Kent. The LSE Health and Social Care unit is led by Professor Martin Knapp. And we are closely linked with the Institute of Psychiatry and in London, and also the National Institute of Health Research. So the work I'm presenting here, the research I'm presenting here was partly funded by the Department of Health, by the Putting People First program, a work program that is now called Think Local, Act Personal, and was very much driven by disability movements in England. It was carried out under the lead of Martin Knapp and myself and my colleagues Margaret Perkins and Tom Snell, and you will find a fuller description of the work in our paper, which is called Building Community Capacity, Making the Economic Case. We're also planning to do more work in this area, and I would like to talk a little bit more about this later and ask of your interest and see if anyone would like to get involved. So what is community capacity building? That's what I'm going to talk about briefly. Why would we want to evaluate the economic value of community capacity building, and how, if we accept that we want to do that, how do we measure it? I'm doing to explain that with a couple of examples on time banks and community navigators, and then I'm giving a brief outlook on some of the research questions that are interesting to look at and some of the policy recommendations. So community capacity building is it's a very broad term. It's not easy to define, but it's an asset-based developmental approach. So I'm not going to talk about disabilities. I'm going to talk about people who have assets. They have needs. All of us have assets and needs, and community capacity building is based on that kind of belief that everyone has assets, everyone has something to give. And also that changes over time. So the assets that are now available to a person might change over time, might increase or decrease. So somehow this community capacity building process is able to understand the obstacles that prevent people from achieving their goals and work with those, address those, by empowering local people and, in fact, also organizations or neighborhoods, communities, to initiate action themselves. And community doesn't always need to be a geographical unit. It could be also a common identity that connects people. So it somehow leads to something that is measurable and sustainable, that's important at different levels, individual, community, societal level, and so it generates the social capital, also another term that was used and probably misused a lot. There are a lot of reasons why community capacity building is worthwhile. There are people who have been working in that area for a very long time. A lot of people from disability movements who believe in the outcomes such as trust, confidence building, the increase in knowledge and skills, the increase in number of social contacts, social supports, increase in participation. So a lot of outcomes that are all along quality, quantity of life at an individual and a collective level. So just the definition, social capital refers to the networks of social relations that provide access to needed resources and supports. And I took that definition from the Policy Research Initiative in Canada, which then further concludes that any study of social capital should encompass the investment that people make and the returns to those investments in the form of economic, social health outcomes and for individuals, communities, and societies. So there's something around people are investing and there's a return of those investments, which we are trying to measure. So 2 research questions. Can community capacity building help to stop needs before they arise? Does it meet them when needs do arise? And is there active participation? That's for anyone with a long-term care need or at a low level, high level. But these are the questions that if we want to understand community capacity building projects or community projects, then these are the questions we want to be looking at. At a more systematic or systemic level, we want to understand whether greater community capacity actually is able to reduce the demand on the welfare system. And that leads to much wider question on the role of the state from a maybe more kind of production-oriented one to a facilitative one. And so these are very broad and substantial questions, which we obviously can't address with our research here. This is just a small piece of work. But when we look at, we looked, for example, at things like time banks, we looked at befriending interventions and community navigators. And we always try to understand what are actually the pathways to improved mental well-being, quality of life, and often there are costs attached to that. So for example, for befriending interventions, there is a lot of evidence that shows that this is increasing mental well-being. For example, by reducing isolation, social isolation, reducing loneliness. And there's evidence that this leads to an increase in access to services, quality of life, and there's also evidence that in the long term, this can reduce services, things like crisis services, home services, and hospital admissions. So there is always this economic side to it, and that's what we were interested in. So there are lots of barriers when we look at community projects. Most of them are not just in the economic evaluation, but in evaluating those programs in general. A lot of them are because of the organic nature of those programs. Some of them are not government driven, they are bottom up, so they just happen out of collective actions. So people the first thing they're thinking about is not necessarily evaluating their outcomes, and often at the beginning they might not have an agreed set of aims or objectives. And also things take time, so it will be difficult to actually look at outcomes that happen within the first 6 months or 1 year, like randomized control trials do, but it would probably need longer-term studies to understand the impact. In terms of outcomes, it's important not to just look at the outcomes to the individual, not just the participant, not just the direct participant who is a person with a long-term care needs or disability, but also to look at people who are maybe not directly involved, but who are directly benefiting, like the carers of the persons and the extra time that they are having. Also, people who actually provide, who are involved in running those projects have benefits for themselves. So volunteers, there's good evidence that shows that volunteers are benefiting from volunteering. So the increase of skills will help them to, is increasing the likelihood of finding employment, other volunteering opportunities, is increasing self-esteem. So there's a range of benefits to people who are actually not direct participants, but help in running the project. And there are benefits to people who are part of the wider community, who are not directly participating, but who are benefiting from that increased sense of community and things like community safety. So our modeling approach was an ex-ante model. We looked at it, it's called a cost-benefit approach, and it was over a 1-year time horizon. A lot of hypothesis building was required because we didn't actually have any primary data because of these issues in terms of evaluations. So we had to rely on even grey literature, performance reports, evaluations from those projects, these kind of things. And the outcome dimension we identified in that case where the evidence was strong enough was public service utilization, productivity, and quality of life dimensions. and we valued the cost of the intervention from national sources. For example, there's a unit cost book where you would find unit cost. It's published by the PSSIU on most health and social care services. So for example, time banks, if you look at time banks are something where skills are exchanged. So people contribute with whatever assets they have, whatever skills they have in hours of time and get hours of time back. So they might input by providing an IT course for a certain number of hours of time, and they might want to have someone who is looking after their children. So any kind of exchange is possible. In fact, I mean, like, there are a lot of different time bank schemes with a lot of different focuses for people with mental illnesses specifically. For example, there's one in Holy Cross in London. And so there's a range of possibilities. Every scheme is different, but we were trying to understand, on average, what is the economic value of it. So we found that there's the resource input required per participant of 450. There's an economic value of service hours, which amounts to 506. Productivity gains because of the increased likelihood that people will find employment or volunteering because of their involvement with the time bank of 580. And that related to reduced benefit claims of 240, so that there was an average net benefit per person of 876. And then if quality of life improvement were taken into account, then the average net benefit per person was more than 1,500 above. So another example is community navigators. And I'm just looking out for the person with the 5 minutes. I'm so scared. Where would I see? I can still go ahead. Okay, good. So the next example is the community navigators, which actually act at the interface between community and public services. There are people who help, for example, people with disabilities, people with any kind of long-term needs through the system. So they are there, they're community members, they're trained, sometimes they're in informal roles, sometimes they're more part of public services. So they can have any kind of function within any kind of organization, under any kind of organizational form. And the focus they have is usually, if they operate in deprived areas, on housing and debt-related issues. So these seem to be the issues that come up most heavily on the workload of those community navigators. And here we looked at debt advice and took the evidence from 2 English studies. There's also good evidence on the effectiveness of debt advice, the effectiveness of the intervention, and we took that from Williams and Sampson 2007 and Pleasance et al. 2007. So we came to values where we thought the resource input, and that's probably more at the lowest end, is 340. There's an increase in cost because of the additional number of referrals to debt statutory agencies, which is per participant of 180. There are productivity gains, which we valued at 990, and again reduced benefit claims of 140, so that there's an average net benefit per person of 610, and if quality of life improvements due to reduced depression symptoms was included, it came similar to the time bank intervention, in fact, to just under 1,500. So there are a lot of limitations. Very hypothetical what we did in our research. It was based on assumptions from the literature. We didn't have a comparison group, so we weren't sure what would have happened without the community project. We had to make those assumptions by looking at national sources, statistics. So we don't know for sure what would have happened without the project. And also we have worked with averages and typical values, whilst in reality those schemes will look so differently depending on the local area, what they were trying to do, the target groups, and so on and so forth. And Also, just methodologically, there is still a standardized approach needed and probably new and innovative research methods that we should be looking at. So, policy and research recommendation. There is a need for self-evaluation. If there's a role for community capacity building, then projects, and increasingly in England, they're actually interested in finding out what the economic value is. So there is a need for collecting outcomes and cost data that can be used for evaluation and economic evaluation, and do that in a more standardized way. So there is also a need of, in terms of methodology, there is a need of developing something that is more agreed, so that actually the findings are comparable across projects in terms of methodology. And again, like new innovative research methods are required, so that people feel like they have been included in the research from the beginning, there's a participatory approach. These kind of things are really important for projects that operate at very bottom-up, very kind of empowerment-based, following that kind of approach. And there's also a need to actually develop service models and look at what would be innovative, what would be actually effective and cost-effective in achieving the outcomes. So there are two projects I just would like to talk about briefly, where we want to take this work further, because at the moment it just has been a very humble and small attempt to actually try to understand what community capacity can do and what it can't do. So for England, we are planning to have research of 10 community capacity building projects that are spanning across a wide range of areas, mentoring and befriending interventions, interventions for people, for older people, people with disabilities, targeted at those in a kind of networks, ways in Leeds, I think that is, and time banks, other time banks. So a range of projects that we want to be looking at in terms of the costs and outcomes they're achieving, and actually getting primary data over a year's time period. And there's another project at a more European level we would like, where we would be looking at exactly the same thing, but maybe with a broader focus on the role and impact of community capacity building, and the identification of best practice within those countries, and maybe develop something that is valid across countries, across European countries, and again, like look at the economic payoffs. So if anyone is interested in that work, I would be very happy to talk to you later, or just email me. I think you have my email in front of you on the presentation, on the handout. And I thank you very much for your attention.